Hey, welcome everyone. Guess what we're talking about today? Yep, it's hair loss. I know. It's a topic that many of us, especially us guys, would rather not think about. But hey, it's a reality for a lot of people, and it's something that's worth discussing. You see, hair is often seen as a sign of youth and good health. So, when it starts thinning or falling out, it can really knock your confidence. But remember, if you're going through this, you're not alone. There are millions of people out there facing the same issue. In today's video, we're going to get real about hair loss. We'll talk about why it happens and share some proven ways to prevent it. So stick around, and let's tackle this together. There are plenty of reasons for hair loss, whether it is genetics, stress, or poor nutrition. I have summed up the most common causes for hair loss below. Let's take a look. Genetics. Androgenetic alopecia, also known as male pattern baldness or female pattern baldness, is a genetic form of hair loss. It can start during your teenage years and is more likely to develop if you have close relatives who also developed it. Autoimmune diseases. Conditions like alopecia areata and lupus, where your immune system attacks your hair follicles or tissues and organs respectively, can lead to hair loss. Scarring hair loss, also known as cicatricial alopecia, is a type of hair loss that results from the destruction of hair follicles. It's usually the result of inflammatory or autoimmune disorders, infections, chemicals, burns, or injuries. Scarring alopecia usually appears as a bald patch where there's typically hair. The skin where hair used to be tends to look smooth and shiny. Hormonal changes. Imbalances caused by pregnancy, menopause, or thyroid conditions that lead to an underproduction or overproduction of thyroid hormones may cause hair loss. Lysine deficiency. Lysine is an essential amino acid that plays several roles in humans, most importantly proteinogenesis, but also in the cross-linking of collagen polypeptides, uptake of essential mineral nutrients, and in the production of carnitine, which is key in fatty acid metabolism. Hair loss is one of the symptoms of lysine deficiency. Poor nutrition. Deficiencies in nutrients like vitamin A, vitamin C, vitamin D, vitamin E, zinc, iron, niacin, biotin, folic acid, and selenium can cause hair loss. Lifestyle factors. Stress, lack of sleep, and certain hairstyles that pull hair tightly can increase hair loss. Now that we understand the common causes for hair loss, let's explore some effective ways we can try to prevent it from happening. Avoid over-drying your hair after shower or rub them with towel. Over-drying can cause your hair to lose moisture, which can cause your hair to be dry and brittle. This won't have an effect on your natural hair growth cycle, but it can lead to breakage and visible hair loss. Excessive rubbing of the towel on the hair can cause frizz and damage. When your hair is wet, it's more fragile, so towel rubbing is more detrimental to wet hair than when hair is dry. It is recommended that you wrap your hair with a towel or even a t-shirt after showering to soak up the excess water. Avoid hairstyle that would pull your hair tightly. Some hairstyles like ponytails, dreadlocks or extensions that constantly tug on your hair can cause strands of your hair to break or fall out. Over time, the continuous pulling can damage your hair follicles. If your hair follicles are damaged, your hair cannot grow back, hence leading to permanent hair loss. Avoid using harsh chemicals on your hair, for example, hair dye or hair perm. Hair dye can damage hair by affecting its proteins and lipids, leading to loss of hair strength and thickness. The chemicals used in hair dyes, such as ammonia, hydrogen peroxide, and p-phenylenediamine, PPD, can alter the hair's structure and cause damage. Hair perms use chemicals to break and reform hair bonds, which can weaken the hair and make it more prone to damage and breakage. They can damage and weaken the hair and lead to hair loss. Try to reduce your stress by taking some time off from work and relax with your family or friends, as stress increases the level of cortisol, and cortisol has been shown to disrupt the growth of hair. There are 3 types of hair loss associated with stress. Telogen effluvium. Significant stress pushes large numbers of hair follicles into a resting phase. Within a few months, affected hairs might fall out suddenly when simply combing or washing your hair. Trichotillomania. This is an irresistible urge to pull out hair from your scalp, eyebrows, or other areas of your body. Hair pulling can be a way of dealing with negative or uncomfortable feelings, such as stress, tension, loneliness, boredom, or frustration. Alopecia areata. A variety of factors are thought to cause alopecia areata, possibly including severe stress. With alopecia areata, the body's immune system attacks the hair follicles, causing hair loss. Maintain a healthy diet. Hair requires proper nutrition to grow and stay healthy. Certain nutrients, including vitamins A, B, C, D, and E, lysine, iron, selenium, and zinc, are particularly important for hair health. Sometimes, even though we take all the precautions discussed above, we may still experience hair loss due to genetics or other reasons. But don't worry, there are plenty of approaches we could pursue, including natural remedies, mechanical treatments, and medical treatments in order to halt hair loss or enhance hair growth. Let's take a look together. Natural treatment. Pumpkin seed oil. It blocks 5-alpha reductase and has anti-androgenic effects. In a promising studies where 75 men with androgenic alopecia received 400 mg of pumpkin seed oil per day in a 24 weeks period. At 12 and 24 weeks there were 30% and 40% mean increase in hair count respectively. Saw palmetto. This is another natural suppressor of both type 1 and type 2 5-alpha reductase. Multiple human studies have demonstrated a slight regrowth of hair when patients with androgenic alopecia used a product containing saw palmetto, either orally or topically. The improvements included an increase in total hair count ranging from 3.4% to 27%, up to 83.3% of the patients experienced increase in hair density. The suggested amount range from taking 200 to 500 mg per day, and it is advised to split into 2 portions daily. Caffeine. It stimulates hair growth in both male and female. There was one recent study showed caffeine might actually counteract stress-induced hair damage and possibly prevent stress-induced hair loss. Curcumin. It aids in reducing the levels of inflammatory cytokines, which are linked to hair loss, and it has also been previously demonstrated that curcumin can suppress the expression of androgen receptors, which are known to play a role in hair thinning. Mechanical treatment. Microneedling, also known as collagen induction therapy, is a minimally invasive procedure that involves puncturing the outermost layer of skin with dozens of tiny sterilized needles, with common length ranging from 0.2 to 3 mm. Microneedling increasing the growth factors in the local vicinity of where you've done the procedure, as your body looks to repair itself. The procedure also stimulating specialized hair follicle stem cells, which can trigger enhanced hair growth. Usually the thickness of the hair tends to increase rather than the density of the hair throughout the treatment. According to Dr. Gary Linkov, androgenic alopecia, alopecia areata, telogen effluvium are the type of hair loss conditions that are suggested to be effective with microneedling, and out of the 2 common tools that are used for the procedure, dermapen is recommended over dermaroller, as the roller may cut the hair during the process. The recommended frequency of having microneedling varies from weekly to every 8 weeks. Dr. Gary Linkov mentioned if you are planning on doing it at home, starting out at 0.5 mm needle length, and doing it monthly are suggested. After microneedling, the applied area may be red and inflamed for a few days following the procedure, and there's also a risk that the wounds caused by the needles may scar, so it is strongly suggested to consult a professional hair doctor beforehand. Low-level laser therapy, also known as photobiomodulation, is a non-invasive, pain-free treatment that uses low-intensity light to stimulate biochemical changes in cells. This process helps repair tissue and reduce inflammation. One of the most common applications of LLT is the stimulation of hair regrowth in individuals with hereditary hair loss. Low-level laser therapy works by irradiating photons into scalp tissues. These photons are absorbed by weak cells, encouraging hair growth. It's widely accepted that the procedure is safe, tolerable, and less invasive than hair transplant surgery. The therapy may work by triggering vasodilation, a widening of blood vessels, and stimulating the flow of blood to specific areas of your skin, such as your hair follicles. This may cause your hair to enter into the anagen or growth phase of the hair growth cycle. Research suggests that LLT can prolong the growth phase of the hair cycle, stimulate follicles in the resting phase to transition to the growth phase, and slow down the transition to the regression phase. The Food and Drug Administration, aka FDA, currently clears these devices for treating male and female pattern hair loss or androgenic alopecia. Medical treatment. Ketoconazole is an antifungal and anti-inflammatory medication used to treat certain infections caused by fungus. It is available in different forms such as oral tablets, creams, and shampoos. There are studies showing that in the form of a shampoo, ketoconazole helps with hair loss and potentially promote hair growth. PRP, or platelet-rich plasma, involves drawing a patient's own blood, processing it to concentrate the platelets, and then injecting the platelet-rich plasma into the scalp. The platelets are believed to promote healing and growth in the treated area. Finasteride. Finasteride is a medication that treats certain types of hair loss, like alopecia. It works by increasing hair growth on your scalp. Finasteride belongs to a class of medications called 5-alpha reductase inhibitors. It works by blocking the conversion of testosterone to dihydrotestosterone, aka DHT. This blocking process increases the number of scalp hairs and slows hair loss. As advised by Dr. Gary Linkov and Dr. Andrew Huberman, for people that are experiencing androgenic alopecia, taking the oral form of finasteride at a dosage of 0.5 to 1 mg per day is an effective and safe starting place for most people. It has been shown to rapidly lower serum and scalp DHT levels by over 60%, and as you take finasteride it will stabilize hair loss and promotes hair regrowth. Topical form of finasteride is another way to treat androgenic alopecia. However, it has not been approved by FDA yet. While it is not FDA approved, topical finasteride is preferred for patients who want to be safer and avoid systemic side effects. Early studies on the topical form indicates encouraging outcomes for hair growth, and it seems to be no less effective than the oral form. The common side effects of finasteride includes erectile dysfunction, ejaculatory dysfunction, reduce in libido, and sign of depression. If you decided to take finasteride, be reminded that it is designed to be used long-term. If you stop taking this medication, you will likely start losing your hair again. Minoxidil. Oral minoxidil was initially approved for the treatment of high blood pressure in the 1970s. However, patients reported growing excess hair while on the medication, leading to the development of topical minoxidil for hair loss. Oral minoxidil has been shown to enhance hair growth by prolonging the anagen phase of the growth cycle. According to Dr. Gary Linkov and Dr. Andrew Huberman, the doses are as low as 0.25 mg for women and 1 mg for men that's been shown to be effective. However, there are studies showing that for men, the recommended dose is 2.5 to 5 mg. Topical minoxidil is a liquid solution or foam applied directly to the scalp to promote hair growth and prevent hair loss. Dr. Gary Linkov advised that for men with androgenic alopecia, it is recommended to apply 1 ml of 5% minoxidil solution or half capful of 5% minoxidil form twice daily. The common side effects of topical minoxidil includes contact dermatitis, headaches, and hypertrichosis. The common side effects of oral minoxidil includes fluid retention problem, which leads to swelling of feet or lower legs, bloating, fast or irregular heartbeat, and flushing or redness of skin. If you withdraw from minoxidil application, studies have demonstrated a gradual reduction in hair over a period of 12 to 24 weeks. That's all for today. I hope you guys enjoyed the video. Remember, everyone's hair journey is unique, and what works for one person might not work for another. Always consult with a healthcare professional before starting any new treatment. If you found this video helpful, don't forget to like, share, subscribe, and turn on the notification bell for more content like this. Until next time, I'm out.